menstrual cramps that are extremely painful and prevent you from doing your daily activities are not normal. This is what nobody tell you. Extreme period cramps equal something being wrong. Hey there, welcome to my channel, Bingo It's Kimbo, where on Wednesdays we chat reproductive health. I'm Kim, also known as Good to All, Doctor to Some, and this is a safe place where we discuss and celebrate being a woman. If you haven't already, go ahead and click that subscribe button and become a part of the Bingo Babe family. This week we will be talking about endometriosis. Ooh, child. This is a really hard topic for me to talk about, as I was recently diagnosed and I'm still trying to find ways to cope with the constipation that feels like I'm passing glass and the debilitating cramps that come the day before and during the 3 days of my menses, and then just disappear out of thin air just to return in 29 to 38 days. It is a struggle, but I declare healing over myself, and one day I will definitely be sharing my PCOS and my endometriosis journey. Today is not that day, but it's coming soon. Before exploring endometriosis, let's first do a quick recap on the female reproductive system, which is comprised of 2 ovaries, 2 fallopian tubes, the uterus, the lining of the uterus called the endometrium, the cervix, and the vagina. If you guys are interested in learning more about the reproductive system, you guys can check out my Vagina Demystified series, a series focused on the normal and not so normal conditions of the vagina, and I really enjoyed making that entire series, so you guys can check it out after this video. Prior to discussing endometriosis, it's very important that we understand the organs that are in the pelvis. This includes the reproductive organs we just spoke about, and the rectum, part of the colon, and the urinary bladder, just to highlight the important organs there. Alright, now that we covered that, let's dive into endometriosis. Endometriosis is a condition where the lining of the womb is found outside of the womb. This includes the uterus, ovaries, fallopian tubes, cervix, and structures that are in the pelvis that we spoke about before. When this lining of the womb called the endometrium is found in other places, like the endometrium found in the womb, it also has a period. Inside of the womb, there is a vagina which leads outside of the body where the period can flow. Now, when you have a period outside of the womb, there's really nowhere for this bleeding to go, and this results in scar tissue, ovarian cysts, and adhesions of the pelvic organs to the structures and or to one another, resulting in complications of this condition. Endometriosis can be classified into 3 types. The first being the superficial type, which is found on the lining of organs outside of the womb. Second is the deep type, which is classified as not just being on the lining, but actually invading into the organs and causing further complications. The third type of endometriosis is called ovarian endometriomas, where the deposits are on the ovaries, resulting in ovarian cysts that are blood-filled. Also known as chocolate cysts, because this blood that fills up the cyst gets old and turns brown, just like the blood that comes down towards the end of your period, which is pretty brown for most women. Oh, side note, I almost forgot the nickname for endometriosis. Endometriosis is also called endo. So for the rest of this video, I'm going to likely call endometriosis, endo. So if you hear that from anybody or in this video you don't know, say it's endometriosis me I talk about. Good. Okay, so we've now reached the causes of endo, which are not known. However, there are a few things that are linked with the likelihood of developing this condition. The first thing being retrograde menstruation. Now, retrograde menstruation is exactly as it sounds. Normally, menses go from the womb through the cervix, through the vagina, and out the body. Now, in retrograde menstruation, the menses goes back up towards the fallopian tube. Now, this can cause a displacement of endometrial cells, as the cells that are sloughed off during menstruation are then displaced in areas where they do not belong. This brings us to the second proposed cause of endometriosis, which is transport of endometrial cells. Now, this transport can happen by ways of retrograde menstruation, but also through the body's drain system known as the lymphatic system. And another way that the cells can be transported throughout the body where they do not belong is through the blood vessels. The third proposed cause for endometriosis is surgery that involves the womb. Either it be a C-section or even a hysterectomy. The cells inside the womb can then in that process be displaced in areas where they do not belong. So essentially anything that causes the inside or the lining of the womb to be elsewhere is what can cause endometriosis. Now, there are some risk factors that can predispose you as well to endometriosis, and we're going to describe those now. The first thing is a familial link. Now, endometriosis is not an inherited condition. However, it is found that the generation of mothers or even the generation of grandmothers who have endometriosis increase the risk of persons with that history having endometriosis. So if your grandmother have it or your mother have it or anybody in the generation have it, there's a possibility that you may develop it. The second risk factor is early menarche, which means an early first period. Early is before the age of 11, like your girl right here. My first period is when I was between 9 and 10 years old. And this risk factor is significant because when you go into the reproductive phase of your life, the amount of estrogen that you are exposed to based on how the hormones work and everything is increased. Now, estrogen is like the superfood for the endometrial lining or the endometrium for the endometrium. Now, if those endometrial cells are in the wrong place, estrogen also feeds those cells and therefore they become functional and then cause all these issues. So really and truly, any high exposure to estrogen really is a predisposing factor. The third predisposing factor is having short menstrual periods. Now, short menstrual periods are classified as any cycle that's less than 28 days over a period of 3 or more cycles. For very heavy periods, like them period where you need a nighttime maxi pad them, but in the day, like 8 to 10 pads a day, them period they may talk about. Them period day, yeah, is a predisposing factor of developing endometriosis. 5. Conditions that affect the normal outflow of menses, such as abnormalities or anomalies in the anatomy of the uterus. Not every uteri looks like this. Alright, there are different types, and one day we'll definitely be able to explore this. In fact, I'm going to add a link below of the different types of uterine anomalies. But long story short, if there is a complication in the normal flow of menses, there's an increased risk of developing the endometrial cells in places where they do not belong. 6. Any condition that causes a hormonal imbalance where estrogen is significantly higher than progesterone. And lastly, 7, conditions where your immune system is compromised, and or you have an inflammatory disorder. Now this list of 7 risk factors aren't all the risk factors. There are quite a few, and I'll add a link in the description box of a more extensive list if you're interested in seeing the other factors that predispose persons to developing endometriosis. Can affect every individual differently. Some people may experience life-altering symptoms, while others may be asymptomatic, meaning they have no symptoms at all. The first and most notable symptom of endometriosis is extreme pelvic pain or menstrual cramps. And I want you guys to know that menstrual cramps that are extremely painful and prevent you from doing your daily activities are not normal. This is what nobody tell you. It is not normal. Extreme period cramps equal something being wrong, and you should go to the doctor and find out what that issue is. Do not sit in silence. Too many times as a doctor, I see women coming in after 15-20 years of dealing with extremely painful cramps. It needs to stop, and I'm really emphasizing this point so that if you are someone who's experiencing debilitating period cramps, that you no longer have to sit in silence and in pain, and you can be encouraged, like I was, to go and find out what the issue is. And I digress. Back to the pelvic pain. So for endo, the pain usually happens about 3 days leading up to the menstrual period, and during the menstrual period it typically goes away until the following cycle. And despite the common myth, the amount of pain that one experiences does not equal the extensivity of the condition. So in other words, you can have extreme pain and only have superficial lesions, and you can have like no pain and have deep lesions, and that's why it's really important to get worked up for. 2, excessive bleeding during periods. So them heavy periods that's associated with extreme pain. But there could be other things like fibroids and other topics that we haven't covered. But again, go to your doctor to find out what it is if you are suffering with these symptoms. Third point, there can also be spotting in between the periods, which means light bleeding between your menstrual cycle. I mean, there's a lot of causes of this, but this is also a symptom of endometriosis. Next point, extensive intestinal pain when going to the bathroom leading up to or during your menstruation. Now, I personally can attest to that symptom. Just thinking about it, I feel like I'm on a ball. It almost brings me to tears, because I get waves of anxiety when I have to use the bathroom when I'm on my period, because I know that it's going to be very painful. Why? You know, like, why? I believe we're at point number 6, which brings me back to the digestive symptoms that I forgot to mention, such as nausea, diarrhea, and even bloating. Those things are also associated with endometriosis. Point number 7, which is a big complaint for a lot of the patients that I see, very painful sex. Very painful, and this pain is usually a deep pain, nothing superficial, but really like deep down discomfort. And lastly, a major symptom or complication with endometriosis is infertility. Big difficulty in getting pregnant, and this is for several reasons, but the most notable one is due to adhesion formation caused by the extensive scarring. Alright, let's quickly talk diagnosis. After recording your personal history, such as your symptoms, and doing a full examination, your doctor will likely request further testing based on the history that you've given them. One of the most common tests requested is an ultrasound, just to get a closer look at what's going on in the pelvis to help lead to or rule out the diagnosis of endometriosis. Ultimately, however, the only way to officially diagnose endometriosis is with a laparoscopy, which is a minimally invasive surgical procedure that allows cameras into the pelvis and lower abdomen to determine whether or not there are lesions present. And even sometimes your doctor can even take off samples of tissues in the pelvis to determine if there's a microscopic presence of the endometrial tissue. Interested in the treatment of endometriosis, I must say there is no cure for endometriosis, and that fact has proven to be one of the most difficult truths about this condition. Being a doctor, and I know you're expecting me to just dive straight into medicine, my rule of thumb for almost every issue that can arise in the reproductive system and overall when it comes to health is lifestyle modification. Turning your life around and going in the right direction. And a way that you can do this or help with endometriosis is increase water intake, decrease estrogen ingestion, and regular exercise. These things can help regulate your lymphatic system for proper drainage, increase your immune system, as well as minimize the amount of estrogen in your body, which feeds the endometriotic lesions that causes the issue of this condition. Now, if lifestyle modifications do not work, your doctor can opt to give you hormonal therapy, which predominantly includes oral contraceptive pills. There's other forms of hormonal therapy, but typically your doctor would aim for oral contraceptive pills as they've proven to be most effective in this condition. If oral contraceptive pills don't work to help minimize the effects of endometriosis, there are other forms of hormonal control, such as medications that decrease your estrogen production. The only thing with these medications is that it stops your period completely and essentially puts you in something called a pseudo-menopause, where you don't see your periods because the estrogen levels are so low, but subsequently you don't have any complications associated with endometriosis. Another form of treatment for this condition is surgery. Now, with surgery, you can go in and remove the endometriotic lesions, resulting in a relief of symptoms. However, again, there is no cure for endometriosis, so there is always a risk of the lesions returning. However, that temporary relief is something that a lot of people look forward to and therefore opt to get surgery. The last thing regarding treatment for endometriosis is pain medication, and typically the medication used is over-the-counter medication like NSAIDs to really help alleviate the pain associated with the condition. And I mean, pain period, most people use over-the-counter pain medication. Alright, we've reached the last part of the video, which talks about coping tips for endometriosis. I came up with 3 things that really stood out to me while dealing with this condition, and the first thing is to trust yourself and speak up. I want you to know that it is okay to speak up if you're experiencing pain so bad during your periods that it affects your everyday life. I want to encourage you, no matter who said what, or if they look upon you and tell you, say you don't look sick or you don't look like you're in a lot of pain, I want to encourage you, no matter how painful or hurtful those things are, to get up and say something. 2, everything is not over. Now, I remember when I get the diagnosis, me nearly have body come down. Like, Lord Jesus, I was pumping now. I'm not married yet. I don't have any kids yet. Like, I'm 25. I need to jump on it. Oh my gosh, my time is running out. No, stop right there. That does not have to be the case. There are treatment options available for appropriate management of symptoms and complications associated with endometriosis. Either it be the pain, straight down to the complication of infertility or complications getting pregnant. There is a plethora, so many options, and as mentioned before, it is very important to get the diagnosis early and treat and manage it rather than sitting around waiting in pain, disregarding the issue and not getting appropriate management. 3, find community. This is a part of the reason why I'm speaking up, so that you know that you're not alone if you have endo. Whether your endo family is online or in person, it is a very important aspect of coping with having the condition. It provides a safe place to open up and even discuss symptoms, complications, and even coping mechanisms to help you get through this thing, because it is not the end. With all of that said, if you do suffer with endometriosis or know someone that does, I would love if you comment below and I will pray for you or them. Also, my Instagram page, dr.goodtoall, is created for simple questions you have about reproductive health issues. You guys can check out that page. Don't hesitate to ask your simple questions. I answer messages on Wednesdays and Fridays. I really hope you guys enjoyed this video. I enjoyed creating the video as usual. Don't forget to like, share, comment, subscribe, especially the share part, because there's a lot of people suffering in silence about endometriosis, and the more people that know, the stronger we are together. I hope you have a beautiful day or night whenever you watch this, and subscribe. I'm almost at 3,000 subscribers. I'm so excited. Bye.